Hello, Junta. My name is Dr. Rachel Foreman, and I'm part of Stamp Out Stroke. Thank you so much for joining us today. The mission of Stamp Out Stroke is to educate the New Haven and surrounding communities about stroke risk factors, warning signs, and the importance of getting prompt treatment and care if you are having a stroke. If you have any questions or would like us to come to your community center, please email stampoutstroke@gmail.com. Thank you so much.
Hi, Junta. My name is Dahlia. I'm a nurse at Yale New Haven Hospital and a current student at Yale School of Nursing. So I will be part of the presentation team here with my colleagues. Before we get started, just a disclosure about today's presentation. The information provided is general information about stroke risk factors, symptoms, and treatment. We are unable to provide individual medical opinion or suggestions, but encourage these questions to be discussed with your primary healthcare provider. First, let's talk about your brain. So your brain is the main control center for your body. This is the location where we move, speak, see, feel, sleep. All these feelings come from there. Nutrient-rich oxygenated blood helps feed your brain to help these control centers keep working. It communicates with our heart via the carotid and the vertebral arteries. So our body, the main control center. So what is a stroke? Many strokes occur because a blood clot blocks the vessel and the oxygen-rich blood cannot keep moving. The rest of the vessel then begins to suffer as a result, and nearby brain tissue is unfortunately damaged. Where the stroke occurs indicates the kind of symptoms a patient will have. Some strokes, about 10 to 15% of them, are caused by a vessel bleeding, which is called a hemorrhagic stroke. Some quick stroke facts. Every 40 seconds, someone in this country suffers a stroke. 80% of these strokes are preventable. Stroke is the number 5 cause of death in this country. So talk to your doctor about your individual stroke risk.
So now I'm going to talk about the modifiable risk factors for stroke, and these are things that you can change. And so the number one most important one is high blood pressure. And this is the number one cause of stroke, and a lot of people, more than 20% of people, don't even know that they have it. And another risk factor is smoking, and then physical activity, obesity, and obesity is where you have a BMI of 30 or higher. And then there's high cholesterol, diabetes, atrial fibrillation, and sleep apnea. So in terms of physical inactivity, it's important to try to get at least 30 minutes of activity most days of the week, and this will lower your risk for stroke. And there's also risk factors that are non-modifiable and things that you can't control. And these include age and gender. And in terms of gender, women have more strokes than men. And then there's ethnicity, and African Americans are at higher risk of stroke, and this goes along with their higher rates of high blood pressure, diabetes, and obesity. And then there's family history. This is where if your mother, father, grandparents, or siblings had a stroke, this places you at higher risk for a stroke yourself. The important part, though, is that you can lower your risk of stroke. And so it's important that you make an appointment to see your doctor to talk about your blood pressure, cholesterol, blood sugar, or your family history of stroke, or any of the other risk factors that I discussed earlier. And it's important that you talk to your doctor personally, as they can help recommend things for you. Another important thing is to know when someone is having a stroke. And so we like to use a saying called be fast, and each of these letters stand for a different thing. So the B in be fast stands for balance. And so someone who's had a stroke might have issues with balance. They might be stumbling, they might fall. So it's important to then check for these other signs. And so the E in be fast stands for eyes. And so they might have changes in vision or double vision. And then the F in be fast stands for face drooping. And so this might just be on one side of their face that droops and the other side of their face still looks normal. And so then the A in be fast stands for arm weakness. And this can just be where they can't lift their arm normally or do the normal things with their arms. And then S in be fast might stand for speech difficulty. And this might be through speech slurring or not being able to come up with the right words that they're thinking of. And then finally, T in be fast stands for time to call 911. And so then this is what you do when you see someone having a stroke or you think they're having a stroke. You call 911 and you tell the operator you suspect someone is having a stroke. And this is important because the faster someone gets to the hospital, the faster they can be evaluated and treated by stroke experts. And this is important because the patient's brain can be saved and they can suffer less devastating consequences from the stroke. And time is of the essence because my colleague later will discuss the specific treatment, but it's important to know that the treatment is time sensitive. So it's important to be fast because time is brain.
When it comes to treating stroke, there are two things we can do. First, we give TPA, which stands for tissue plasminogen activator. It's a medication that can break up blood clots. The important thing is that it's time sensitive. It needs to be given within 4.5 hours of stroke onset. Sometimes it must be done within 3 hours. Otherwise, it's too late for the medication to help. So that's why it's so important to identify stroke early. Second, doctors can do a thrombectomy, which is a surgical procedure to remove blood clots. It can theoretically be done within 24 hours after the stroke, but it's often limited to within 6 hours since it becomes too dangerous and ineffective as more brain is damaged. My colleagues have done an excellent job of covering the many medical and physical factors that can greatly increase or lower your risk for stroke. They talked about heart disease, smoking, high blood pressure, high cholesterol, sleep apnea, diabetes, physical inactivity, and more. But what about other risk factors? We know that psychological, interpersonal, and vocational factors are also important risk factors for stroke, even when we account for the other factors we talked about. Psychosocial distress has particularly been associated with increased risk of stroke. In one study, the most distressed patients had a 31% increased risk of stroke compared to similar peers. In another study, high to very high psychological distress was associated with 37% increased stroke risk in men and 81% increased stroke risk in women. Researchers have done further investigation into specific psychological factors. They've done meta-analysis studies, which are very comprehensive types of research. A recent meta-analysis study found increased risk of stroke among people with a number of other psychological conditions, including schizophrenia and bipolar disorder, as well as other stress-related conditions, such as pessimism or low life satisfaction. Importantly, the majority of studies have found a relationship between depression and stroke. In one of these studies, people with high levels of depression symptoms were 2 times more likely to have a stroke. In another study, it was estimated that almost 4% of stroke cases in the US could be attributable to depression. Anxiety is also associated with a 24% increased risk of stroke. In addition, PTSD, which stands for post-traumatic stress disorder, has been associated with elevated risk of stroke in younger people, even after accounting for other things like anxiety or depression. In one of these studies, rates of stroke were 2 to 4 times higher among 9/11 survivors with PTSD than among those without PTSD. It has also been noted that depression and anxiety are both associated with other poor health behaviors, including smoking, alcohol, and physical inactivity. These are convincing studies because they controlled for other risk factors like cardiovascular disease or smoking. The bottom line is that these studies were well executed, and there's convincing data that psychological factors like depression, anxiety, and PTSD lead to higher risk of stroke. So there's a lot of ways to reduce these risk factors. A good first step is to talk with your doctor. There are many effective medications and therapies for depression, anxiety, and PTSD, and your doctor has the medical expertise to get you the right treatment. Another good step is to ask for help from your loved ones and close friends. Your support network is there for you to listen, understand, and care for you. And people are often surprised at how powerful and beneficial that is. Along the same lines, it can be helpful to find and engage in an enjoyable social activity. And there's many different kinds. It can be something like going for regular walks with a friend, joining a book club, or even going to church if you're religious. Lifestyle is also an important aspect of reducing these risk factors. It's important to practice mindfulness, which can mean finding time for yourself and/or meditating. Exercising indoors is a great option, and there's so many ways to do it. One popular way is to use home workout videos on YouTube as a guide. Finally, it's important to get outside, and even though it's tougher when it's cold outside, something like a quick jog or walk can go a long way over time. Studies have also found that spending time in green spaces, like parks and gardens, is associated with reduced incidence of stroke in urban populations. And doing these things really makes a difference. People with persistently elevated depressive symptoms had a 65% increased risk of stroke compared to those with consistently low levels of depression. But once the depression symptoms went away, the risk of stroke returns to normal.
When it comes to power of attorney, we encourage you to talk to your primary care provider about planning ahead in the event you are no longer able to speak or advocate for yourself. These are not easy conversations, but it is important to discuss your opinions and views with your family and friends. Also importantly, in the current COVID-19 pandemic, less patients are coming to the hospital for stroke evaluation out of fear of contracting COVID-19. But we want to remind you it is very important to still call 911 and come in for evaluation in the event that you experience stroke symptoms. The hospitals are taking precautions to protect their patients from exposure, and you can miss out on treatment options by delaying care. Remember, time is brain. So here are some take-home points from our presentation. Many strokes are preventable. Talk to your healthcare provider about your risk factors. Be FAST, the acronym we use for stroke warning signs. And finally, time is brain. Call 911 if you or someone you know is experiencing a stroke. We have some resources available if you want to learn more about stroke or hear about support networks for patients who have survived strokes. So please feel free to visit these websites if you're interested. Thank you very much for listening to our presentation. We hope you find this information valuable.